Well, Halloween just a few days away, and with COVID numbers rising, safety needs to be top of mind. In today's To Your Well-Being, we're going to take a look at how you can stay vigilant about preventing the spread of COVID-19 during Halloween-related activities. Cone Health's Infection Prevention Medical Director, Dr. Cynthia Snyder, she is joining us. So let's talk trick-or-treating. First and foremost, people want to know, all right, is it safe, given that we're in a pandemic, to do some trick-or-treating?
You know, that is a great question, especially in a community where our rates are getting so much higher than they were a few weeks ago. I think if you can find alternatives not to go out trick-or-treating, I think that is the best way to avoid any risk. But I know many children and folks who really love Halloween, and so if you can definitely make sure you're wearing a mask, right, the whole time. And that also the group that you go trick-or-treating with should be small, and that even though they may be your friends, if they're not your household members, they definitely should still be wearing a mask. And we recommend kind of like alternative ways of celebrating. You know, could you do like any type of like virtual Halloween party with kids? You know, could you have a few friends over and do an outdoor Halloween pumpkin carving type of contest? Things that avoid folks from being indoors and without masks. That tends to be the highest risks.
Okay, so let's say we are going to go outdoors to trick or treat. Is it something where we can let the kids go with their friends, or should they only be traveling in a pack of people that they actually live with?
So, you know, again, it's about the kind of those risks that you're willing to take. I would say that it's best just to go trick-or-treating with your own household. And then if you, or just limit the size of the group of kids to less than 8. And the key thing is that making sure that they wear masks the whole time. And we're talking about like their respiratory mask, you know, their droplet mask, not their Halloween mask. And especially if you're going to be riding in a car to going to a certain neighborhood, again, you know, you don't want to be in a place where it's in a very tight enclosed area. So it's important to wear the mask all the time. And especially when you're going from house to house, I would be very cognizant of like which homes you're going to. You know, you want to go to a home that, you know, that people are wearing masks at as well. And then also try to avoid, you know, getting into a bigger group with other kids that you may not know.
We still have to do that 6-foot distancing thing. So let one kid go up, get their candy, come back, and let the other kid go out.
Correct.
Okay.
As much as you can. So I'm hoping when folks are deciding to distribute candy, like consider creating like little, I guess, like treat bags, and then distributing them already like kind of placed out maybe on a table that's already dispersed a few feet apart. And then also, I think it makes sense to making sure that, you know, that you're doing proper hand hygiene and trying to avoid any aspects where people having to touch numerous objects around your, like the doorknob or the railway or anything like that.
We've had a couple people who've actually made their own candy delivery system with like PVC pipe or something so that they don't even have to do that, which I think is fun. All right, so when we're talking about the Halloween mask and you're talking about the respiratory mask, the Halloween masks that usually come with many costumes and things, do we double those up? Can we wear one instead of the other?
Oh gosh, I know. I would say that, you know, the Halloween masks are always made for just decorative purposes, whereas, you know, a respiratory mask that you see commonly in healthcare, or even kind of your fabric mask, it's meant to be a little bit tighter around your face. So I would try to choose a costume that you can use your own fabric mask, and then try to avoid the doubling up, but the fabric mask is the most recommended.
Mm-hmm. So maybe do some, you know, makeup, that kind of thing, and then use the fabric mask instead of using the mask that comes with the costume. All right,
Correct.
so when it comes to eating the candy, because we all want to eat the candy, the kids want to eat the candy, should the wrappers be wiped down before they're opened and eaten?
I think I would say for folks who've had COVID disease within the last few weeks, I would recommend that they do not distribute any candy, because we want to make sure that they're not contaminating any kind of candy that they're dispersing to folks. In terms of kids, that they received candy, one thought is that you exchange it. Like parents can maybe exchange some of their candy that that you've purchased, or I don't think it makes sense to like spray Lysol on any candy, and just in kind of the similar things that we do normally is that you don't want to eat any candy that's already like where the packaging is slightly open. You want to have all that kind of be in place, and it should be safe to eat.
I mean, is there a specific time or anything like that that they should wait, to handle the candy and then eat it, that kind of thing? I mean, if they stick it on top of the refrigerator for like 3 days, is that good enough?
I guess so. I'm not sure if we know quite yet what that means. Yeah, I would say that the key part is that recommendation if you're distributing candy to ensuring that you're doing it either like with your hands who you've washed, with some hand sanitizer or soap and water, or consider wearing gloves and then distributing the candy.
Gotcha. Okay. So if we do go out trick-or-treating, other safety tips and recommendations still apply from year to year to year, whether there's COVID-19 or not. So can we talk about some of those just regular, everyday Halloween trick-or-treat safety recommendations?
Correct. So I would say like anything, if any of the packaging does not look intact, you should get rid of that candy. And then also, there's always choking risks with any candy that's round shape. And, I know certain kids may be quite young and probably shouldn't have that type of candy as a choking risk.
Mm-hmm. All right. So
and again, it's just proper safety, ensuring that when you're going out that you have enough, some sort of lights, be part of your costume, because I'm sure we always hear about some sort of like automobile accident with a pedestrian or a trick-or-treater, which is quite horrible.
Mm-hmm. All right, Dr. Snyder is going to be with us until 6 o'clock answering your coronavirus-related questions, and you can text those questions to us. We're going to give you the number. This is it, 336-379-5775. Remember, this is text only, so don't call, and we'll get the answer to your question.